Okay, hello everyone, and welcome to our third segment of the 2021 CCLP Legislative Preview on health and healthcare. Really exciting, action-packed half hour for you coming up. I'm going to give you a few logistical details. My name is Bruce Barnum. I'm the Development Director at CCLP, and then I'm going to introduce our presenters today. So as you join the webinar, please put your name and organization here in the chat box as a welcome. Just as Kessie has demonstrated, so we know who's here and can say hello to each other in a way that works in this webinar format. As you have questions throughout the presentation, please put them in the Q&A box. So you'll see that at the bottom of your screen, just a couple of buttons to the left of the chat box. So feel free to put questions in there at any time as they occur to you throughout the presentation, and we will get to them at the end after the presentation, and we will hopefully be able to answer all of them or as many as we possibly can. Also, in case you missed either of the two sessions earlier in the day, or you want to watch this one later, share it with folks, get anything from it at a later time. We are recording the session and we will post all of them on our YouTube channel within the next couple of days. So stay tuned to that, and our social media, we will let you know when that is ready to go. All right, and with that, we will be moving on to our presenters for today. We have Allison Neswood, our Deputy Director of Strategic Priorities, and we also have a special guest, one of our very strong community partners, Kayla Frawley, Manager of Policy and Advocacy with Clayton Early Learning. So I'm going to turn it over to Allison first, and she's going to introduce Kayla and get us started. Allison, go ahead and take it away.
Thanks, Bruce, and hi, everybody. And I'm really delighted today to be presenting our legislative preview focused on health. And I'm particularly happy to be here with our great partner, Kayla Frawley. Kayla is the Manager of Policy and Advocacy at Clayton Early Learning Center, and she is a knowledgeable and effective advocate for infant and maternal health equity. And what I love most about Kayla is her commitment to centering the experiences and the expertise of women, and in particular of women of color, in infant and maternal health advocacy work. Before I pass it off, I'm just going to cover our agenda today. I'll talk about our health and the special session that happened in December, and a few of the health issues that CCLP will be working on and watching during the upcoming session, as well as some of the challenges and opportunities that we see for improving healthcare in Colorado. But first, I'm going to turn it over to Kayla to talk about how racism impacts maternal and infant health. We invited Kayla to talk about this because, of course, it's a really important issue in its own right. But also, I really wanted to frame today's conversation with the fact that racism is a social determinant of health. One of the more sobering statistics I've heard about the COVID-19 pandemic is that if Black Americans had died at the same rate as white Americans due to the COVID-19 pandemic, over 21,000 Black Americans would still be alive today. This is devastating and shameful, and all of our policy initiatives should have the goal of reversing the social and economic, the structural root causes of this devastation at their core, at their center. So without further ado, I'll go ahead and turn it over to Kayla, and then come back and talk about the other items. Thanks, Kayla.
Thank you so much, Allison and CCLP, for having me. An honor to be presenting with you all today. I have a short presentation on a community project that incorporated 5 listening sessions with different Coloradans around the state to identify the issues and solutions in infant maternal health in Colorado with a specific focus on perinatal racial disparities. So the report is coming out soon. It is called Diverse Colorado Voices, Community-Based Solutions for the Perinatal Period. Next slide, please. And the objectives of these listening sessions was to really allow community voices to set the policy agenda for the Raise Colorado Coalition that I work with, and identify 3 issues in infant maternal health and 3 solutions to partner and collaborate with local birth equity leaders. Off to our right, we see Demetra Sariki, who's the only Black certified professional midwife in the state of Colorado, along with all of our other co-hosts and facilitators who are birth equity leaders. And by definition, I mean doulas, certified lactation counselors, peer support specialists, and birthing people themselves. Another objective was to also build and align policy objectives for 2 to 3 years with our partners like CCLP and other folks that are very committed to addressing perinatal racial disparities, and with a heavy focus on perinatal racial disparities. As we know, Colorado does not have great data surrounding what disparities we're really looking at and how well providers are at addressing those within their practices. I just want to also highlight Demetra more, because she is really the only perinatal safe spot in Colorado. That definition and certification was made by Jenny Joseph out of Florida, who's also a certified professional midwife. And what it means is that she has eradicated health disparities within her practice. So she's the only provider in the state of Colorado that we know of that has made it so there is no racial disparity among all of her different clients, irregardless of their racial or ethnic background. So she should be highlighted. Next slide, please. Just a quick insight into the methodology and participants that went into this. We did have 64 participants from 27 different zip codes in Colorado. And what participants did was they were surveyed, but we also did long listening sessions, and then took those findings took those findings and then also did one-on-one interviews with 15 different participants who also participated in the listening sessions. It is important to note that 64% of the participants racially and ethnically self-identified as other than white or Caucasian. And you can see the breakdown of self-identification racially and ethnically of all of the participants. And that's just a map of Colorado and the different zip codes that we did highlight. Next slide, please. So just for purpose of today, we're really going to focus more on number 1, the issue bucket of systemic racism. But when we really asked, these communities and these individuals in Colorado, what were the 3 biggest issue area buckets in regards to infant maternal health, they really gave us this feedback that 1 is systemic racism. And I think that we've all been noting that is in the general public, but hopefully this presentation gives a little bit more insight into the tangible examples of what we're seeing across the board when it comes to the lived experience of racism, both implicit and explicit. And then we also saw the issue bucket of the lack of postpartum care. Within that bucket, when we really tear into that data, we found the lack of lactation support and the lack of mental and behavioral health supports as being the biggest pieces of the number 2 bucket. And then number 3 is systems level inadequacies. So that is to note that, across the board, the standard of maternity care is pretty subpar. And also that there's a lot of issues in the inequities of insurance reimbursement and many populations not having access to community providers. So on the next slide, we're going to look a little bit more into number 1. So when we looked at experienced racism in the perinatal period, and within this slide deck, we have many different quotes and stories actually from various different participants who gave their input and or are birth equity leaders in the state of Colorado who experienced racism in various different ways, either while they were providing care to someone else or while they were getting care themselves. And those voices are really the backbone of this report and really the backbone of all of this data. So when we're looking at experienced racism, we saw, glaring patterns, non-consensual procedures being done that went anywhere from having tubal ligations done to not being told that that they were getting a vaginal check done in labor, and lack of education, and then lack of explanation of procedures. And that is during a procedure, present time, and then postpartum as well, when there is time to actually talk about the procedure. We also saw this other sub bucket of lack of access to community providers and lack of representation and lack of client choice of provider. Everybody knows we have to diversify the workforce of perinatal care providers. And then the last sub bucket here is providers ignoring symptoms and concerns that were often recognized later on once we are now dealing with severe maternal morbidity. And then we also, of course, saw explicit examples of racism when folks were told by providers, an example is from Shelby Urban, who was told very explicitly, that Black women are lazy and they do not breastfeed. And that is exactly how she was told by her lactation consultant in the hospital. And so those are kind of the sub buckets of the experience of racism that we see. I just put down there below that community providers are defined as doulas, midwives, certified lactation counselors, and other providers that are outside of the hospital system. Next slide, please. And so I'm going to share the next couple slides as quotes so that we can really dig deep into that experience of experienced racism and how you can imagine this impacting and impeding care. This is from Pia Long in Denver, Colorado, who runs the Denver Doula Volunteer Program at Denver Health. The medical providers are explicit and implicit. An Ethiopian woman was bleeding out. Her doula was a Muslim doula and she was brand new. There is not only the physical pain, but also she heard from the nurse, "Why are we celebrating?" And then we redacted a derogatory term remark to Mr. Floyd, referencing George Floyd, who was killed by police this last summer in Minneapolis. This woman had a postpartum hemorrhage and bled out. How do we create training so that folks are aware of their biases and prejudices? Systemic racism has impacted all of us. We need to know how to not impede someone's care so quickly. Next slide, please. This is from Shelby Urban, who is our only Black certified lactation counselor in El Paso County. She's an incredible birth equity leader. There needs to be access to becoming a doula and certification. There are boundaries and barriers that have been created specifically for people of color who want to help their community and who want to be there in the realm of birth working, and they are not able to. We've been doing this for centuries, and now we cannot go into hospitals with these women because we are not certified. There are traumatic events that are happening in regards to these women not being informed. Something needs to happen so that women should have to give a verbal okay, yes to anything that they are doing to us. Next slide, please. This is from Maria Limon out of Bayfield, Colorado. The issue in maternity care and racial disparities is it isn't just a language barrier, it is a cultural difference. It is white dominant cultural supremacy negatively impacting our families. When my sister had her son, she was dismissed. She raised questions about how the baby was doing, but it wasn't until things got worse that she was heard. It turned out that her baby's kidneys were not developing. The developing kidneys, were a sac of fluid. She knew something was off, but her concerns were ignored. And this is an incredibly common experience where concerns were ignored over and over and over again. Next slide, please. Back to Demetra Sariki in Colorado Springs, who is an incredible birth advocate in Colorado. El Paso County in general does not want to discuss racism. They were not willing to accept the fact that there are instances in our makeup differently. An example is heart disease. For many years, heart disease was treated the same to all clients, regardless of racial identity across the board. But why aren't we acknowledging that our bodies are exposed to different chemicals and perinatal disorders like preeclampsia? Demetra Sariki, Colorado Springs. Next slide, please. And so within this report, we also were able to pull from the three issue buckets that we talked about kind of in the beginning of this short presentation and plug them into four solution buckets, 3 to 4 solution buckets. I say 3 here, but it's really 3.5, maybe 4, that the community identified as solutions. We do know that populations most impacted by policies are necessary in the development of good, sound, equitable policy. And so these solutions do come from the community. Within those, I'm not going to go into the 24 implications that will be in the full report when you get it, but the 3 solution buckets that we had were support and design and implementation of anti-racist policies, invest in prevention-focused care, community birth, and the perinatal workforce, and then reimagining and redesigning postpartum care and addressing systems-level inadequacies. The perinatal workforce includes all professionals in and out of the hospital system that provide care during the perinatal period. Next slide, please. And so when we further break down, When we further break down those buckets, we really break them down into systems, which was the first one I had mentioned, and then workforce, and then there's innovation. And so these are just, again, some of those 24, but when we look at kind of the baseline, the basics and systems and the immediate things that are necessary to change if we want to continue changing other things, is we need to desegregate data by race and ethnicity. I think folks across many sectors agree with that. We need to create committees to really dismantle racial inequity in all policy. And we need to ensure that all Coloradans are insured, documented and undocumented, and improve grievance processes to track obstetrical violence. So that would be tracking the non-consensual procedures and some of the other issues that were mentioned through the quotes on these slides. For the workforce, there's a lot of things that we have to do for the workforce as well, including diversify and educate the perinatal workforce, integrate the model of midwifery care, make doulas and midwives more accessible, particularly for communities of color that have a very culturally congruent relevance to birth equity and to the model of midwifery care and to doulas. We do need to expand reimbursement options, not just Medicaid, but other reimbursement options, and standardize lactation training across anybody who deals or has any interface with families during the perinatal time period, so from prenatal through age 2. Some of the innovative strategies and solutions that came up, we know this ledge session may not be the time for them, but it's worth putting them on the table. Support innovative solutions to address intersectional issues. This is where our colleagues, of course, at CCLP and other places really come into play. When we start to think about housing, substance use disorder services, and mental and behavioral health, and expanding childcare for infants and toddlers, and looking at how all of those things intersect with infant and maternal care in Colorado. Next slide, please. And so I bring this slide up because this is from the National Association to Advance Black Birth, and this is a list of Black birthing rights, Bill of Rights. It has been used by national birth equity leaders, including the National Black Maternal Health Caucus, and it was also used and is being used to advocate for Omnibus, the package of maternity care bills at the federal level. It speaks to all of the experiences that we heard from community, that they want to see themselves in their provider. They want to feel supported by a doula. They want to choose their health care. They want to determine what's right for their baby. They want to be able to have affordable health care. All of these pieces have been turned into a Bill of Rights. And so with that being said, the best approach to maternity care in Colorado and elsewhere is a human rights approach. And so later on in the legislation session, you will hear about the Justina Ford Act, and I'm welcome to talk about that in our Q&A session. But that will be a statewide birth equity platform for Colorado. Thank you so much for having me today. I am honored to be here with my colleague, Allison Neswood, and I will go ahead and pass it back over to her.
Great, thank you so much, Kayla, for your great work in this area, for centering our great community leaders and for bringing their voices to this presentation today and to the advocacy space, health advocacy space. It's so important. I'm going to jump right into the sections of what I'm going to talk about today, and hopefully we will still have some time for questions at the end. The first thing I'll address briefly is the special session that took place over 3 days in December, and in particular how the work done over those 3 days impacted health. There wasn't particular health care legislation passed during the special session. However, in addition to the resources put towards public health, the housing and food security work done during the special session were critical health initiatives. I won't talk in detail about the specific bills because my colleagues Sarah Lipowitz and Jack Regenbogen talked about those a bit during their presentations, but I do want to note the connections between housing security and health and food security and health. We often think about homelessness when we think of housing insecurity, and of course there are health consequences to homelessness, which is associated with injuries, chronic illness, mental health challenges, and premature death. But there are also very severe consequences when housing security, or even when housing security doesn't result in homelessness. You know, or housing insecurity can result in people being housing cost burden, meaning they're spending a disproportionate amount of their income on housing costs, or it can cause them to live in unsafe neighborhoods or unsafe housing. And these different types of conditions are associated with a range of health conditions, increased experiences of violence and injury, chronic stress and its physiological consequences, depression, suicide, respiratory diseases, and developmental challenges in children. It's just a range of issues that, I know a lot of people on this call are very aware that housing is healthcare, and so really addressing those housing insecurity issues is critical. Same thing with food insecurity. It's associated with higher rates of obesity, heart disease, toxic stress, depression, and suicide. And so we really need to make sure that our Colorado neighbors are getting access to the basics, especially during this hard time. And before the pandemic hit, too many Coloradans were struggling with housing and food insecurity, and the pandemic has only made it worse, particularly for low-income Coloradans and Coloradans of color. So we really worked or really strongly supported that work done during the special session. In terms of the upcoming regular session, I'm going to talk quickly about 3 legislative efforts and 1 budget item. And during the question and answer session, feel free to ask more about these items, and to also ask Kayla, if we have time, about some of their initiatives. But in terms of CCLP's main healthcare priority, it's about better protecting patients from high hospital bills. We do have hospital financial assistance provisions on the books in Colorado. However, those provisions originally passed in 2012 are not meeting the objective of ensuring that uninsured Coloradans can manage their hospital bills and get information about their rights. And so there are strong consequences of this. 15% of Coloradans have medical debt in collections, and 25% of people living in communities of color are struggling with medical debt in collections. And so that's 1 in 4 people living in communities that are already, where financial insecurity is already concentrated due to structural issues. And so really important to get a handle on this. The bill is going to focus on capping the amount that uninsured patients can be billed by hospitals by tying to Medicare. It's going to focus on putting standards in for fair payment plans for low-income Coloradans. It's going to focus on making sure that hospitals screen patients for public programs that they're eligible for, and for the discounts created in this legislation. And it's also going to focus on sort of aligning the screening processes so they're streamlined across different programs, they're consistent across different hospitals, and they're reliable, so patients can better know what their rights are and access the financial assistance that's available. In addition to that main priority, CCLP is helping the Mile High Medical Society advance a proposal to establish a racial equity task force, ideally in the governor's office, so it will have that cross-agency authority. The Mile High Medical Society is a society of Black medical professionals and students that are dedicated to advancing racial equity in the medical profession and in the communities they serve. The work of the task force will focus on improving equity in the internal and external operations of state agencies, so dismantling structural racism in government by implementing equitable hiring and retention policies, improving data collection across agencies to highlight inequities across multiple substantive areas, and establishing health equity assessment processes for agency decision-making. And the task force will also be charged with developing a blueprint for advancing equity across substantive areas, including healthcare, food and housing security, economic well-being, criminal justice, and neighborhood health. And I'm not going to go into these because we are running short of time, but we do expect to see a public option proposal come back again. CCLP doesn't have a position on the proposal, but is looking to see how it impacts, the ultimate proposal will impact low-income consumers and how it will impact equity. Lastly, we are excited to see that HCPF has requested additional funding to improve and coordinate the data systems at their disposal. To improve the data, they have to identify health disparities, understanding what these disparities are, where they are, what they look like, and their scope is a critical first step to addressing the disparities that we see. So we're glad to see this work at HCPUF, and we hope that it will continue across state agencies and in different areas of government. Lastly, I'll just note some challenges and opportunities. We do continue to face budget challenges, despite a somewhat rosier budget projection in December. And this will limit the amount we can spend on critical programs and an equitable recovery in Colorado. We also have a profit-driven healthcare system, which makes reforms that impact the profitability of health industries challenging, however critical those reforms are. And on the opportunity side, I am heartened by what seems to be growing awareness that healthcare access for all and strengthening our commitment to public health are essential to the health of our communities. And especially in light of recent events, I am heartened to see a growing awareness that racism impacts health and that we need to do something about it. I think what I take most heart in is the fact that Black, Indigenous, and people of color have been showing us how to fight this fight since the founding of this country. So I invite all of us to recognize that strength, to honor that work, and to join in. And with that, I'll turn it over for questions.
Right. Wow, thank you, Allison, and also Kayla, tremendously moving and powerful presentation. So thank you both for that so much. So now it is time for questions. Hopefully you've all been able to find the Q&A box. It's at the bottom of your screen, just a little bit left of the chat. If you pop that open, you can go ahead and type in a question, and I will read the questions as they come in. And Kayla or Allison, you can feel free to answer them, whoever wants to jump in. So first question we have so far is from Paul, and he's asking, are there trainings for doula or midwife certification for Spanish speakers?
Thanks for that question, Paul. And indeed there are. And I'd be happy to chat more offline about those opportunities and or where to find those mentors. But there are many of the schools that teach doulas are ran by women of color. And so there's a couple different specific schools that do teach in Spanish. And the midwifery school that I actually went to when I was previously a midwife is also a bilingual Spanish-English clinic, and that's called Maternidad de Luz in El Paso. But I would be happy to join you offline and talk more about some of those other opportunities.
Great, thank you, Kayla. Next question we have is from Rebecca, and she asks, do you think it's highly likely for the high hospital bill legislation to pass?
I do think that we've done good work to get it there. I think we have a good sponsor in the House in Rep-elect Judah, and the different players on this, CCLP, CCHI, other advocacy partners, and the Colorado Hospital Association did come together with the objective in 2012 of making sure that this process, or that patients could navigate their hospital bills effectively and manage those costs. And so I think there's precedent there for sort of different players to work together, and we have done outreach to the Hospital Association and are hoping that we can really get everybody on board to making this work better for healthcare consumers. I mean, it doesn't help hospitals either if people can't pay their bills, and so we want to make this manageable. We want to make sure that people are getting connected to the coverage programs where our hospitals can receive reimbursement from, and so I don't expect it to be super easy, but I do think that we're doing the work necessary, and we have a strong case.
Good. Okay. Thank you, Allison. And Rebecca says thank you as well. Okay. I see no more open questions. So unless somebody has a last one they want to put in there, we will wrap up. Okay. Here we got one. This is from Laura. As a workforce issue, does being certified as a doula or a lactate specialist have a viable career pathway?
That's a great question, Laura. And I think that the issues that we're seeing in workforce is that we just have to diversify the workforce and then educate other providers that may not actually have any lactation training. And so, yes, there are many doulas and or lactation specialists, certified lactation counselors, or IBCLCs, which is a totally another certification, that have found a very viable career in servicing birthing families and families during the perinatal period.
That's a good question. I see just a question in the chat. Would Kayla be willing or able to share her slides with the audience? Yes, and I would say the slide that's up right now has contact information for Kayla and Allison both. So if you have a specific question or you want to get in touch with them for any reason, please jot that down or make note of that. And then as I mentioned at the start of the presentation, we are recording this session and we're going to make it available within the next couple of days on our YouTube channel. So you can watch actually the entire presentation, share it with folks, and feel free to do that. It'll be freely available. So yeah, that should cover that one. Oh, and Laura was saying, someone asked earlier what a doula is. I think Kayla may have answered that one in text, but Kayla, do you want to answer that so everybody can hear it as well?
Absolutely, and that's also a great question. A doula is a birth worker who has been trained in emotionally, physically, and mentally supporting people in labor and postpartum. So you have postpartum doulas and then you have labor doulas. And I think it is worth noting that they've been recognized by ACOG, by the World Health Organization, and by other global leaders in maternal health because their presence often lowers cesarean rates, improves birth outcomes, saves on cost, and decreases maternal mortality and infant mortality.
Good, and I have one here from Shar as well. She's asking, is Colorado likely to ramp up temporarily or permanently our public health infrastructure due to the need for vaccines and et cetera?
You know, I don't know exactly how that's going. I mean, our whole country, including Colorado, is right in the middle of you know, a historic effort to disperse a vaccine, and you know, there's a lot of conversations around the equity of that process. I don't know if Bethany's also online for questions. If you had anything to add on that in particular.
Well, I do think that the pandemic has highlighted what the impact has been of our decreasing investment in public health. So I think that's an effort that we would certainly support, and we'd probably defer to our partners at CalFO and other public health entities for more insight. Sorry about that. How we can assist in that work.
Thank you, Bethany.
Okay, yeah, thank you. And Bethany is CCLP's legal director for any folks that don't know her, just chiming in there. Okay, good question. All right, well, I think that concludes the questions we have in front of us. So thanks again to both of our presenters and panelists for all of that tremendous information. Really appreciate it once again. And thanks to all of you for joining us today. We just have one more of these relatively short bite-sized pieces of our legislative preview event yet to come. And that'll be at 4 o'clock today. We're gonna have Jack Regenbogen, our senior attorney, and Cesaya Guadarrama Trejo, our special guest from 9 to 5 Colorado, joining us. Should be a tremendous presentation about housing issues. So please tune back in a little bit less than 90 minutes to catch that last piece. We will see you then. Thanks again.